So, as I just mentioned, defendants that have a personality disorder are not able to use the insanity plea. And so, this brings up the question, how would it be determined that the insanity plea is not applicable because the defendant has a personality disorder? So, in order to answer this question, there are three questions that also must be answered. And the first is the diagnostic criteria for personality disorders distinguishable from other disorders? So, the functional impairments that are associated with personality disorders can be severe and similar to the functional impairments that are associated with other mental disorders. And so, because of the high rates of co occurring disorders also found among those with personality disorders, it would have to be determined if the symptoms that they have that are of their personality disorder are those distinguishable from any comorbid disorders, which brings us to the question, if there are comorbid disorders present, what are the relative contributions of each to the legally relevant impairments? So, which specific symptoms of their disorders are contributing to their misconduct? And additionally, it would have to be asked, what are the relative contributions to the legally relevant impairments during the specific circumstances of the offense? And so it would be impossible to reliably figure out what the relative contributions of each are. And additionally, within the context of the crime, it would also be impossible to figure out what the relative contributions are. And so, in summary, there would be many bad answers to bad questions. And so, in trying to determine answers to all of these questions, there may be a greater focus on the diagnosis rather than what impairments were actually legally relevant. And so, because clinicians are given the responsibility to figure out if there was some kind of scientific basis for their accountability.